Welcome, doctors. Running a pediatric clinic is all about keeping children healthy and supporting families. But behind the scenes, there's one administrative step that often creates more headaches than it should: insurance eligibility checks. Now, parents usually assume their child's insurance has been confirmed before the visit. But when that doesn't happen, families end up with denied claims, surprise bills, and a lot of frustration. And for clinics, it means delayed payments, endless phone calls, and sometimes even losing trust. One pediatrician shared, "We had to call a mom back 3 times because her child's coverage wasn't verified." That's the reality. Eligibility mistakes don't just cost money, they cost relationships. So why is it harder for pediatric practices than adult clinics? Well, kids often have dual coverage under both parents. Medicaid rules change from state to state and require strict verification. Add in the sheer number of visits for vaccines, well checks, and sick calls, plus seasonal surges like back to school or flu season, and the workload quickly piles up. And the cost of missed eligibility checks is steep. Denied claims, payment delays that drag on for weeks or months, staff productivity sinking as they battle insurance portals, and perhaps most damaging, parents who lose confidence in your practice. For front desk teams, the challenge is real. They're juggling sick child check-ins, scheduling follow-ups, answering phones, and checking multiple insurance portals all at once. And when 3 parents walk in at the same time, guess what gets pushed aside? Real-time eligibility tools integrated with EMRs can confirm coverage the moment a visit is scheduled. Parents appreciate knowing copays and deductibles up front. Some practices are creating specialized eligibility teams, staff dedicated solely to handling dual coverage, Medicaid, and high-volume checks. This frees the front desk to focus on families, while reducing costly denials. And then there's outsourced support, HIPAA-compliant partners who verify coverage ahead of every visit. Clinics that go this route cut down on missed eligibility and strengthen trust with families. One clinic director shared, "Having a remote team saved our staff hours each week." Another said, "We no longer lose revenue from preventable denials." The truth is, eligibility verification may be invisible to families, but it directly shapes their experience and your clinic's bottom line. Every parent expects clarity, and every error leaves a mark. That's where Staffingly comes in. We provide HIPAA-trained eligibility verification specialists who take the burden off your team, reduce denials, and help your clinic focus on what really matters: caring for children and supporting families.